Oh, hey there. I didn't see you. Thank you for joining us in the Life of an L&D nurse today. We have a delivery. Let's go check it out. So the first and most important thing is we need to put our mask and gloves on before we go and help mom deliver this baby. Mom, I'll be right with you 1 second. So let's get our gloves on and go see how mom's doing. I heard that she's fully dilated at 10 centimeters, so we want to go check that out. Let's see how she's doing. How you doing there today, Mom? So mom's fully dilated at 10 centimeters. So mom, can you do me a big favor and go ahead and give me a big push? Perfect. One more, and I think I can see the baby's head. And perfect, there we go. This baby's really blue. This baby looks a little blue to me, so let's do a little assessment, see what's going on with him. Let's try to simulate him, nothing. All right. I'm gonna just take a quick listen to his heart really quick. He has a little bit of a heart murmur. I'm gonna feel for his pulses. They're a little diminished. He's breathing kind of quickly right now. His heart rate's fine. He has a very irritable cry. And I would give this baby an APGAR score of 5 for his first minute of life. Well, the baby's still not improving. Let's give the baby some oxygen. Can I have the oxygen mask, please? Thank you. All right, let's just put that over the baby's face and hopefully improve its oxygenation. So it's been about 10 minutes and the baby's still refractory to oxygen. I'm going to take a quick listen to the heart rate one more time to see if the murmur's still there before we call the doctor. Somebody call Dr. Chung quickly. I think we have another case of... Hello, Dr. Chung? Oh, I'm glad to have you on the phone. I think we have another case of the TGA. I need you to come check this baby out quickly. That's okay, baby. You have Dr. Chung. He's one of our best coming. Come on in. Oh, Dr. Chung, I'm glad to see you.
So what's going on?
Not much. I think we have another case of the TGA.
Another case, huh? Did you plug in the battery?
I completely forgot.
So let's get an echocardiogram stat and do a Doppler examination for me. And we will have the prostaglandin ready, right?
Well, what's the prostaglandin for, doctor?
Come, I'll show you what's that all about. So it looks like the echocardiogram's ready. Let's take a look at it. Oh yeah. Oh yeah. Yeah. So it does look like another case of TGA. Let's call St. Jude and tell them we're gonna be there in about 3 hours. Have the helicopter ready. And did you prepare the prostaglandin?
I did. Now, doctor, I have a question for you.
Yes.
What is TGA exactly, and how does prostaglandin help?
All right, come. I'll show you. So in order to understand the pathophysio of TGA, we have to understand the normal anatomy and physiology of the normal heart. Okay, so we'll start off at the superior vena cava, right here, and the inferior vena cava, right here. So we know that deoxygenated blood returns here, in here, and it goes into the right atrium, which pumps into the right ventricle, right? Which pumps into the pulmonary artery. This is all deoxygenated blood. And it goes into the lungs, okay? Once it goes into the lungs, the blood gets oxygenated, and I'll use green for it. It gets oxygenated, and it goes back into the left atrium, right here, which then pumps back into the left ventricles, right? And then it pumps into the aorta, which goes throughout the rest of the body and oxygenate our system. So now that we understand how the normal heart works, we're going to go to the abnormal heart, or TGA, transposition of the great arteries. So I showed you guys that deoxygenated blood returns from the SVC, the superior vena cava, and the IVC, right? This is deoxygenated blood returning back, again, into the right atrium, right? which pumps into the right ventricle. And with this abnormal heart, the aorta is on this side, on the right side instead of the left side, so that it pumps blood throughout the body, deoxygenated blood throughout the body, and that's why the baby appeared blue and refractory to oxygen. Okay? So with oxygenated blood, let me change to green. So oxygenated blood from the lungs, right, returns to the left atrium from the pulmonary vein, right, and it goes into the left ventricles, and it pumps here to the pulmonary artery, right, because it's switched. But with the baby, you got to keep in mind that they have something called the ductus arteriosus. So there's an opening right here, and it's a temporary opening for a little bit. And we're going to use this to our advantage because with this opening, the ductus arteriosus, we can get some of the oxygenated blood into the deoxygenated area. So we get mixed blood throughout the body, right? And this closes soon, so we're very limited on time. So with the study we found, with the use of prostaglandin, we can keep this open for a while. Or we can do surgery right away and put a balloon here to keep it open until we can find a facility that can perform the ASO surgery to swap these. So you understand everything, right?
I think so. From a nursing point of view, my patient has decreased tissue perfusion and hypoxia because it's not saturating blood very well, only through the duct that we're keeping open with the prostaglandin that we are administrating.
Correct.
Okay.
So let's get the baby ready, administer the prostaglandin,
Okay.
and have the helicopter ready, right?
Yes. Okay. So if I understand TGA correctly, I want to keep the oxygen mask on to increase tissue perfusion. I'm going to give this prostaglandin to maintain the ductus arteriosus open to increase our mixed blood saturation so the baby can make the transport to St. Jude and have their arterial switch operation to correct this disease. I don't know if you're here, but the helicopter's here, so good. Say goodbye to your baby, okay? We're off to St. Jude. Let's get to the helicopter quickly, people.